no compromise whatsoever on our existing standards. If anything, if we could amplify them, we did that.
Dr. Mirrah. I'm the Group Medical Director at GEMS Education. It's a pleasure to be here at the company with all of you guys. Thank you, Dr. Hanan again. It's been a pleasure to meet you, Dr. Ramadan, and Dr. Guru for your support. So thank you, Dr. Tariq, for the introduction to Telehealth. I will touch on things that we have done practically and the real-world experience and what we actually experienced at the ground level in GEMS Education when we introduced the service across our schools. So just to give you an idea, GEMS Education is the largest operator of K-12 education provider in the world. We offer services to an international population of school over 200,000 plus students. This is a number that continues to grow annually. To talk about healthcare at GEMS, we have...
Just 30 seconds wait, please. We're just fixing the slides.
Total healthcare in numbers at GEMS. We have a total number of 52 schools globally. Within the UAE, we have 46 schools. And across these schools, we run 75 clinics. 50 of these clinics are based in Dubai. Out of these 50 clinics, we employ 165 nurses and 50 physicians. These 50 physicians are present on site. They are in addition to the physicians that are provided along with the telehealth services. In November of 2024, telehealth services were introduced by GEMS Education across 14 of our schools in Dubai. For those of you wondering why, we wanted to ensure that we're aligned with the mission and vision of the exemplary leaders of this country and the leadership at the Dubai Health Authority. We wanted to walk the talk and ensure that we are also digitized and future ready across our healthcare services that we provide to our students. We had a vision of implementing a model that involves a blend between medical tradition and modern innovation. A model that exemplifies and enhances our efficiencies and offers quality healthcare services to students without compromising on our standards. We launched a pilot initially before going live. We launched a 6-week-long pilot across 14 schools. The reason we started with a pilot was we wanted to ensure and stress test 4 key areas. These key areas were operational readiness, quality assurance, emergency response, and parent sentiment. Parent sentiment is extremely important to us in the field of education. We wanted the parents to know what our game plan is. We wanted them to feel reassured that there will be no compromise in the quality of standards that we offer them or that they're accustomed to. We wanted to ensure and show to them live that we are prepared for any emergency possibilities like we always have been. And we wanted to ensure that we do not deviate from the standards of quality that we have for ourselves internally and the ones that the regulators expect of us. At the end of the 6-week period, we found ourselves very confident and in a position that we felt we were ready to go and proceed with this model. Now, of course, there is also a business case for telehealth. The first thing that people think of, okay, they must have done this because it's cost effective. Yes, it's cost effective, but there are other aspects also. There's other advantages to this model. Extended access to healthcare. Doctors on site are present for a certain period of time, but there is after-school activities. Schools are beginning to offer health services ensures that the nurses that are present to cover these events have access to a physician throughout this duration. And this help, it continues into point 3, optimizes referral management. Where a nurse would think everything requires an ambulance or an emergency medical referral, a physician would be able to guide them better and tell them, no, this is a cold referral, this can go here, and this person requires an ambulance. This decreases the burden on our emergency medical services. In addition to that it really supports business continuity. There are
that they want to discuss with a peer, a second opinion that they require. Having telehealth services has ensured that we have access to this.
A very quick look at the numbers.
So in roughly about 6 months of telehealth services at GEMS Education, we have had 1,000 plus telehealth consultations. We have had 100% access to DHA compliant and licensed physicians. We have ensured that we are compliant with all of the standards that have been shared with us by the regulatory authorities. The average response time that Dr. Tariq mentioned for telehealth in general has been 30 seconds. That was not acceptable for us in school healthcare. We had asked for it to be below 10 seconds and they delivered. Our average response time has been 9 seconds. 7 minutes is usually the time they take for a telehealth consultation, so we discussed how this model improves efficiencies for us. And alhamdulillah, 0% cases that have escalated to medical negligence or malpractice claims to realize the need for internal consents to be present, an emergency flow response to be present, and issues around data privacy. So we engaged our information security teams, our information technology teams, our risk and compliance teams very early on to ensure that we were compliant with all data privacy laws and we were compliant with child safeguarding laws and whatever is the international best practice, and there was no compromise whatsoever on our existing standards. If anything, if we could amplify them, we did that. Now, technology challenges. In order for this system to work, we have to ensure that there is flawless connectivity at all times. The hardware has to be functioning and ready to go. The institutional firewalls, which are now the norm in every place around the world, need to be compatible between the service provider and those that are receiving the service. And of course, any and all software glitches. So escalation matrices between both organizations are very important. So when a glitch happens, we cannot have people waiting for the call to connect. The IT teams need to be activated right away. Operational readiness. Prior to the plan, the capacity planning that was done, we found honestly we offered them. They didn't feel any difference in our services. If anything, we reassured them that now after school hours also their child is covered by physician's advice while there's a nurse present on site. I wanted to touch on the compliance piece because at GEMS Education, compliance is of utmost importance to us. Compliance with the regulators, not just at the health authorities, compliance with regulators who, the on-site physician says, well, you have a sore throat. We call the parent and say, your child has fever and throat pain, and there's white patches, we want a swab to be done. The parents have the convenience to tap into the resources of the telehealth services, ask for the swab to be done at the convenience of their home or wherever they'd like for it to be done for these services, to then say, yes, this is the result, and yes, the medication can be delivered. These are all untapped avenues that we'll explore, of course, under the guidance of the regulators, but this is what the future